Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about epidermal nerve fiber density, which is a type of nerve test that we do to determine if you have a small fiber sensory neuropathy. Now, the epidermal nerve fiber density test is a biopsy of the skin that is a pathologic study where they actually go in and the pathologist looks at it and determines the numbers of nerves. And it's done in a location that has a normal so that they can actually compare it to normal and say, okay, is this the normal number of nerves? Is there a mild decrease, moderate decrease, severe decrease, or complete absence of nerves in that area? So what does that kind of tell you? The idea is they're looking at the nerves and say, okay, how many nerves are there? If they have a significant decrease or an absence of the nerves, that's a pretty significant small fiber sensory neuropathy. If it's moderate or mild, again, you know that you have a sensory neuropathy. It's earlier on, and you can actually say, okay, I've got a small fiber sensory neuropathy. It's going to be easier to treat if it's a moderate or mild type disease as opposed to severe or absent. Now, the thing you need to understand with small fiber sensory neuropathy is you do get cell death in some cases, and so this complete absence does not mean that you cannot get an improvement. Okay, so we'll come back to that here in a minute. So the other part of this is you can get a normal small fiber sensory neuropathy, and what you'll find is they also look at how the nerves look. Do they look normal, or are they starting to degenerate? If they're degenerating, then that means it's really early stage small fiber sensory neuropathy. So they look at that and say, okay, you do have a small fiber sensory neuropathy. Although you have the normal count, they are degenerating, and so that still confirms the small fiber sensory neuropathy. So, number one, where's this done? Because of the difficulty of a small fiber sensory neuropathy and the side effects or the complications that come with it, we typically do not do this on the foot. Although it would be very accurate, it would give us really good results. If we were to do it on the foot, we worry about the healing in that area because of other complications that can come with peripheral neuropathy. So we usually do it on the calf, and it's located 10 centimeters above the ankle bone, the lateral malleolus, on the outside of the leg. We usually do both legs because, as with other types of neuropathy, the legs can be different. Sometimes they'll be completely symmetric, but it's possible that you can have a severe sensory neuropathy, for example, on your right leg and have a normal left leg. So we test both. And this test can also be run, again, 3 to 6 months later to evaluate changes. We have multiple studies that are showing that with a small fiber sensory neuropathy, if you treat that neuropathy, for example, with vitamins, you could actually get regrowth of the small fiber nerves. And so you can take a severe or absent test and do an additional test 6 months later and actually have nerves regrowing and say, okay, it's now mild or moderate, or maybe it was absent and it's now severe, but you at least have some nerves, which is an improvement. And so we're actually able to test and determine if you have a small fiber sensory neuropathy and the extent of your small fiber disease, and also determine if you're having improvement or worsening of the disease based on treatments that are being undergone. So this test is performed with a small amount of anesthetic to the area. We mark the area, we do a punch, take it, put it in a tube that is then sent off to be studied, where they actually look at it under a microscope. So this is the epidermal nerve fiber density test. It's a very good test. It's usually done in an area that heals relatively easily, and it usually is not painful. In most cases, the small amount of anesthetic is sufficient that you don't feel it. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day